GBS, the Guillain-Barré syndrome, which, as we all know, there has been an alarming outbreak. Now, from the little information that I've gathered, it's an extremely rare disease, one, and it's a disease where your own body attacks your own nerves. Could you elaborate a bit on?
Exactly. So this Guillain-Barré syndrome, or else the GBSE, then GBS syndrome, GB syndrome, it's a well-known neurological entity for most of the neurologists as well as for the general medicine people. Now, this is in neurological terms, we call it as a polyradicular neuropathy. Here, other than the nerves, the radicals, I mean the nerves which are coming out of the spinal cord, at that area also the nerve starts getting affected. Now, this is something, there is something called as an autoimmune entity. Now, Guillain-Barré syndrome, it's an autoimmune disease. The antibodies, or else the chemicals which are being produced, are acting on our own nerves. Now, the classical history of any Guillain-Barré syndrome would be like a patient having some kind of a infection, could be some stomach upset, or else the diarrhea, and or else some kind of a respiratory tract infection. Now, the person will suffer with that respiratory tract infection or else the diarrhea, and he will recover from that entity, and after 1 or 2 weeks suddenly he starts complaining of some kind of a tingling, numbness, which keep on progressing. It usually starts in the feet and it keep on progressing upwards, what we call as a ascending paralysis. Gradually his legs will become weaker and then his hands will become weaker. Now, the reason is the outer coating. The common GBS would be where the myelin, or else the outer coating of the nerve fiber, starts getting affected, and then the antibodies will start destructing the nerve. Now, nerve is supplying the muscle, and that is the reason the muscles become weaker and the disease progresses. And the disease will progress to such an extent sometimes that it will involve the respiratory muscles as well. And sometimes the swallowing muscles can also get involved. Other than the weakness, the patient might complain of a swallowing difficulties, breathing.
That is, if it has progressed quite a bit.
Yes, definitely. Or else sometimes it can directly start involving the muscles, or directly start involving the muscles of the swallowing, as well as the chest muscles also.
So it doesn't have to start at the feet. That's
exactly.
What you're saying.
There are various types of the GBS syndromes. Now, the neurologist would be the best person, or else the physician would be the best person to analyze those symptoms. So it gradually progresses, and then the progression usually happens over a period of 25 to 28 days, and then it stops basically. It worsens. The earlier we detect it and diagnose, and then the earlier we treat, the outcome would be